Sathyabama Institute of Science and Technology.
Good morning. I am Trupti Rekha Pradhan, Assistant Professor, Department of Obstetrics and Gynecological Nursing, Sathyabama Institute of Science and Technology. Today we are going to see the female pelvis, how it will be there, what is the functions, and what is the purpose of the female pelvis, that we'll see in details. In introduction, the women's pelvis is adopted for childbearing and is a wider, flatter shape than the male pelvis. The pelvis is composed of pair of bones which are fused together so tightly that the joints are difficult to see. Pelvis is the bony basin which contain and protect the internal organs of generations. It forms a bony canal of ring through which the fetus has to pass during the process of birth, that is labor. If this canal is of average shape or dimension, the baby of normal size is come out without difficulty. From the obstetrical standpoint of view, it is useful to consider the bony pelvis as a whole rather than separately for the descriptive purpose. It means that female pelvis is not only for the childbearing, it does the childbearing, but it is the ridge, or it is the bridge between the upper trunk and the lower trunk. Also it has other purpose, because with the pelvis the female can walk, can run, can do all the activities. So we'll just go details what exactly it does. So what is the definition of female pelvis? The pelvis is a hard ring of bone which supports and protects the pelvic organs and the content of the abdominal cavity, that is muscles of the leg, back and abdomen are attached to the pelvis, and their strength and power keep the body upright and enable it to bend and twist at the waist and walk and run. Before that, I just wanted to show you the pelvis. So this is the female pelvis as we discussed. So this is the pelvis where it is been there in the female human being. So this is the cavity. Because of this is the ridge between the upper and lower trunk. So here this is the things where the leg is supporting and it is helping for the walking and running. Also it is keeping all the internal organs, all these things, it will be protectively inside the pelvis, like in here. So this is the things what pelvis does. Now we'll see the pelvis anatomically divided into two. One is true pelvis, another one is false pelvis. So what is true pelvis and what is false pelvis? First we'll go the false pelvis. You are seeing the pictures, that is false pelvis. This is the false pelvis. So this is a large flared out part of the iliac bones which lies over the brim. It is not a true basin shape, as some part of it is surrounded by the bone. So that means it says that false pelvis is not like a true pelvis. True pelvis is having it will be like a basin shape, but here it will be flared out part which is above the brim. Brim, that means the above the brim. If you see, this is the things, and above here it will be the false pelvis will be situated. So the true pelvis, it is a curved bony canal, consists of round shaped brim and it is circular cavity, diamond shaped outlet, and in the front part pubic bone, side it is ischial bone, and in the back sacrum and coccyx. So this is three things will be there. Upper part will be inlet, middle part is the cavity, and the lower part is the outlet. As we discussed, cavity will be round, inlet will be upper, that is otherwise known as brim, outlet is the diamond shaped structure. Now we see the pelvic bones. As you already knows, bones in the pelvic, that is bones are there. What are the bones? Two innominate bone, one sacrum and one coccyx. If you see in the pictorial, later I'll show the anatomy and the bone. So the part of the innominate bone, here you see the ilium. This is the ilium. So here I will show you. This is the two ilium, the two innominate bone. So this is the ilium. This is called iliac crest. As it is shown in the picture, it is the iliac crest. The concave side, this is called the iliac fossa. This is called iliac fossa. This is called your anterior surface of the ilium. This is the anterior surface. The anterior means front part of the ilium. This is the greater sciatica notch, and this is the obturator foramen. This is the obturator foramen, and this is the pubic, this is the ischial tuberosity, and this is the pubic bone, two pubic bone joined together making the symphasis pubis. And so this is all about the innominate bone or the ilium, ischium and the symphasis pubis. Now we'll see the part of the ilium. So this is, as we told, that anterior superior iliac spine. This is the anterior superior iliac spine. Anterior inferior, just beneath to that anterior inferior iliac spine. Just opposite to that, posterior superior iliac spine, posterior inferior iliac spine. Then it is called the iliac crest, and this is called the iliac fossa. So this is about the ilium. Now we'll call the ischium. So this is this two part, that is the bony protuberance we called, where will sit, where the female will sit, that is the tuberosity. That is two tuberosity. It is the very vidal part. It will be, this is called the ischial tuberosity. This is the greater sciatica notch. This is the lesser sciatica notch. This is the acetabulum. Acetabulum, two acetabulum will be here. So where the femur of the head will be attached so that the female can be walked. That is the acetabulum. This is the obturator foramen. So this is the two obturator foramen, and this is the pubic tubercle. This is the pubic tubercle, and this is the ischial spine. This is the ischial spine. This is the ischial spine. There is two ischial spine will be there. So ischial spine, what is the role of the ischial spine? Means during the delivery, we are seeing the station of the head, whether the fetus is came down or no. By locating the station, we are seeing the ischial spine. So this is the ischial, two ischial spine. Then coming to ischial tuberosity, as I told you, two protuberance or where the female is sitting. This is two ischial tuberosity. This is the pubic rami. This is the pubic rami, and this is the pubic arch. This is the pubic arch. So this is the part of the ischium. Now already we have seen what are the things. This is the ilium, this is the ischium, and this is the pubic bone. So this is the pictures of that. Now we see the joints, pelvic joints. So where the bones, we know that we have seen the bones. So when two or more bones are fused together, joined together, it's forming a joints. So what are the joints are there? If you see this, there will be sacroiliac joint. As I have already told you, this is the ilium, and this is the sacrum. Posterior side, one sacrum and one coccyx is there. So sacrum and ilium, that is called iliosacral joint or sacroiliac joint. That is two sacroiliac joint. This is one sacroiliac joint and this is one sacroiliac joint. Then coming to sacrococcygeal joint. So this is sacrum and coccyx. Coccyx is the vestigial. We are telling that this is triangular shape and it is movable. During the delivery, it can move backward. So here the coccyx and the sacrum, it is creating one joint, that is called sacrococcygeal joint. That is one. Then symphasis pubic joint. So this is two pubic bone joined together and forming the symphasis pubic joint. So now you know the joints are three joints: sacroiliac joint, sacrococcygeal joint, and symphasis pubis joint. Now coming to the landmarks of the brims. Always you should remember what are the landmarks of the brim. So what are the landmarks of the brims means, one is sacral promontory. So this is the sacral promontory. This is the first landmark, the sacral promontory. This is called sacrum ala or wings. Then coming to the sacroiliac joint, just now it. Then coming to iliopectineal lines, iliopectineal eminence, that is called iliopubic eminence, iliopectineal eminence. Then pectineal line, this is the pectineal line. Then pubic tubercle, this is the pubic tubercle. Pubic crest, this is the pubic crest, and coming to symphasis pubis. So these are the landmarks. So again I am telling the landmarks. This is the sacral promontory. Then coming to the sacral ala joint, then sacroiliac joint, then iliopectineal lines, iliopectineal eminence, then coming to the pectineal lines, then come pectineal lines, then pubic tubercle, then pubic crest, then symphasis pubis. So these are the landmarks of the brim. Then coming to the diameters, very important, we should know the diameters. Why we should know the diameters? Because we should know the complication or any potential risk is there. If the diameters is lesser, then mother might be finding difficulties during the labor. So what are the diameter? Normal diameter, what that we'll see now. So brim diameter. So as I already told you, this is the brim. This is the brim. So brim diameter we'll see. The first one will be anterior posterior diameter. So this is the anterior posterior diameter. So what will happen? Anterior posterior diameter, that is already we know sacral promontory, upper border of the sacral promontory to the upper border of the symphasis pubis, that is 11 centimeter. So this is the anterior posterior diameter. Then coming to the, in this anterior posterior diameter, there is 3 conjugate will be there. What are the conjugate? One is anatomical conjugate, obstetrical conjugate and diagonal conjugate. Now we'll see details of that. Anatomical conjugate, it extends from the upper border of symphasis pubis to the tip of the sacral promontory. So that is called anatomical conjugate, which is 11 centimeter. Then coming to the obstetrical conjugate. Obstetrical conjugate means it is the distance 1.25 centimeter below the upper border of the symphasis. This is the symphasis pubis, below the upper border of the symphasis pubis to the tip of the sacral promontory. This is 10 centimeter. Again I will tell, this is the obstetrical conjugate. In obstetrical conjugate, in symphasis pubis 1.25 centimeter below that, from here to the upper border of the sacral promontory. So it is 10 centimeter. Then coming to the diagonal conjugate. Diagonal conjugate is 12 centimeter. It is the distance from the lower border of the symphasis pubis to the midpoint of the sacral promontory, like this. So from the lower border of the symphasis pubis, the midpoint of the sacral promontory. So it is 12 centimeter. So 11 centimeter, 10 centimeter, 12 centimeter. This is brim diameter, anterior posterior diameter. Then coming to the oblique diameter. Oblique diameter, this is oblique, that is left oblique, right oblique. So we'll see oblique diameter, how it will be there. So it starts from the sacro-iliac joint. This is the, I told you before, sacrum and ilium. This is the sacro-iliac joint. From the sacro-iliac joint to the iliopectineal lines. Already we saw in the landmarks, iliopectineal, from sacro-iliac joint to the iliopectineal eminence. Eminence always will roughen, lines always will smoother. So from the sacroiliac joint to the iliopectineal eminence. So this is called left oblique diameter. Same wise, the right side sacroiliac joint to the left side of the iliopectineal eminence. This is oblique, right oblique diameter. So what is the 12 centimeter? This is 11 centimeter. This is 12. Oblique is 12 centimeter. Then coming to transverse diameter. Transverse diameter like this. So transverse diameter is 13 centimeter and it is the longest distance and it is the farthest point in the pelvic brim over the pectineal lines. As I told you, the lines is smoother. So this is the farthest point of the two iliopectineal lines. The transverse diameter will be formed. So the diameter will be 13 centimeter. Once again, we'll just remember in the brim. So in the brim, there will be diameter. First one is anterior posterior diameter. Under anterior posterior diameter, 3 conjugate will be there. Anatomical conjugate, obstetrical conjugate, diagonal conjugate. That is 11 centimeter, 10 centimeter and 12 centimeter. Then coming to the oblique diameter. In the oblique diameter, left oblique diameter, right oblique diameter, which is 12 centimeter. Then coming transverse diameter, farthest point between the iliopectineal lines, which is 13 centimeter. For easy remembrance, you can remember 11, 12 and 13. 11, 12 and 13. Then coming to the cavity. Cavity is 12 centimeter and depth is 4 centimeter. Then coming to the obstetrical diameter. In obstetrical outlet diameter, this is the outlet and it is diamond shaped. So here anterior posterior diameter 13 centimeter. How it will be measured? It extends from the lower border of the symphasis pubis to the tip of the coccyx. Lower border of the symphasis pubis to the tip of the coccyx. So this will be 13 centimeter. Oblique diameter will be, it will be from the right and left sacrospinous ligament. So sacrospinous means sacrum and spine. This is the ischial spine. So this is a ligament, will be the sacrospinous ligament from here to the obturator foramen. This is the obturator foramen. So sacrospinous ligament to the obturator foramen, it will be 12 centimeter. This is called oblique diameter. The transverse diameter, it is 11 centimeter in between the two spine, that is ischial spine. So this is 11 centimeter. That is called bispinous diameter. So here in the outlet, anterior posterior diameter, oblique diameter, transverse diameter, 13, 12 and 11. Next is coming pelvic ligaments. So we came to know that bones, joints and ligaments, where 2 and more joints are joined together forming the ligaments. So that is a sacro-iliac ligament. Sacrum, this is the sacrum and the ilium. So here it is forming sacro sacroiliac ligament. This is the sacroiliac ligament. It passes in front and behind of the sacroiliac joint. So this is the sacro. So here it is forming the sacroiliac ligament. Then coming to pubic ligament. Pubic ligament connects to top of the pubic bone. So this is the pubic bone. So here it is forming the pubic, that is called interpubic ligament also. Then sacrotuberous ligament. Sacrotuberous ligament. Sacrum. This is the sacrum and this is the tuberosity, ischial tuberosity. So this is one ligament, this is one ligament, the sacrotuberous ligament. Sacrospinous ligament, sacrum and ischial spine. So this is here forming sacrospinous ligament. Then sacrococcygeal ligament, sacrum and coccyx. So here it is forming the sacrococcygeal ligament. So between the one ligament between the sacrum and coccyx. Intrapubic ligament between the symphasis pubis. Between this is the symphasis, this is forming the intrapubic ligament. So these are the pelvic ligament. You are seeing the ligament, how it will be supporting the bones and it is helping the bones to be fractures and to be like performing a good things, and also ligament will be helping for that. Then coming to levator ani muscles. Always levator ani muscles will be helping during the delivery also. So what are the things will be there? One is pubococcygeus muscles, iliococcygeus muscle and ischiococcygeus muscle. This is the pubic region. Pubococcygeus muscles, iliococcygeus. This is the iliococcygeus muscles and this is the ischiococcygeus muscle. So here it is forming the lavatory ani muscles which is helping for the delivery. Then coming to the male and female pelvis, what is the difference between these two? The picture shows how it will be differentiate. The female pelvis bones are lighter and thinner. Female pelvis is shallow. Pelvic cavity is wide and shallow. Pelvic inlet round and oval. Pelvic outlet comparatively large, that is diamond shaped already told. Subpubic angle larger than coccyx, like it is more flexible and straighter. Ischial tuberosity more everted. But in male pelvis, you see the pictures in male pelvis here, male pelvis, the bones is heavier and thicker. False pelvis is deep, pelvic cavity is narrow and deep pelvic outlet, heart shaped and it will be smaller. The pelvic outlet comparatively small, subpubic angle more acute, coccyx less flexible and more curved. Ischial tuberosity longer, face more medially. More and less we are seeing the differences to know that how it is accommodating the fetus and how it will be the shape and what is the characteristics of the male and female pelvis. Now in the conclusion we will see the female pelvis is important reproductive organs where it will be not only keeping the internal organs but also it will be giving the knowledge about the anatomy and physiology. So it will be during the conduction labor, it will be easy for the estimating the progress, to knowing the station, to knowing the dilatations and knowing the landmarks. So what are the things to be taking in keep in the mind? So we came to know that. So it will be helping for the detecting any abnormalities by knowing the normal anatomy and physiology. With this I am concluding female pelvis. Thank you all.